I haven't done a video in a while. I've been researching a lot of different things about our buddy Levine. So let's do this one. This will be relatively quick. It goes back to the COVID crisis, as they called it, pandemic, whatever you wanted to call it at the time. So here's our buddy Levine with Governor DeSantis, governor of Florida. The title, the headline reads, DeSantis health advisor warns more children and teens will be hospitalized from COVID-19. Not a doctor, not an epidemiologist, just sits in an office and, well, when he's not in Florida, sits in an office over in Johnson City and allegedly runs a hospital. So let's take a look here. This is the article itself. Now keep in mind, this is health advisor for DeSantis. Headline, Johnson City, Tennessee. Again, go back to my previous video if you haven't seen it yet about how much time Levine spends working for the state of Florida and for the government in Florida. Time we think he'd be better off spent working for the patients and his employees here. Well, maybe not. Maybe if he spends more time here, we would be worse, and he's already made it. But anyway, that's a subject for a different video. This article says, a member of Ron DeSantis' transition team has advised Republicans on health-related issues, is warning parents that unmasked children are spreading COVID-19 in schools, putting those students at risk of a rare, potentially fatal medical condition. If your child is in school now and there's no masking, it is highly likely your child is being exposed, even though they are asymptomatic. Alan Levine, CEO of a Tennessee-based hospital system, Ballad Health, said. I won't go through this whole video, but the point is, he is not a physician. He is not a medical doctor. He has no medical experience other than telling medical people what to do and ruining healthcare systems. running a healthcare system. He goes on about how these kids are going to bring the virus home from school and more children and teens will be hospitalized, Levine said. Well, interesting here. I don't know how to say this lady's last name, but Christina Pusau, who is DeSantis' press secretary, disputed Levine's claim that unmasked children are being exposed to the virus in the classroom. There's no data to back up that assertion, she said. Mask mandates do not have a statistically, hard for me to say that for some reason, significant impact on the spread or prevalence of COVID-19 in schools. Well, she's right. He's wrong. So he even goes to post it, talk about Levine now, post it on Facebook, this very statement that, run for the hills, wear your mask, children are going to die. Well, I think he closed the neonatal unit in Kingsport, didn't he? Well, if he's so worried about kids, is he more focused on Florida? Has he forgot about us up here in the Tri-Cities, Southwest Virginia, Northeast Tennessee area? Well, several studies have proven that he is wrong, dead wrong. And actually, the masks have hurt the children. Just let me read you one little quick paragraph here. It goes on to talks about the effectiveness of masks. The long-term harm to kids from masking is potentially enormous. From masking. Masking is a psychological stressor for children and disrupts learning. Covering the lower half of the face, both teacher and pupil, reduces the ability to communicate. In particular, children lose the experience of mimicking expressions, an essential tool for nonverbal communication. Positive emotions such as laughing, smiling becoming less recognizable. The negative emotions get amplified, not the positive. Bonding between the teachers and the students take a hit. Overall, it's likely that masking exacerbates the chance that a child will experience anxiety and depression, which are already pandemic levels themselves. So basically, I know he wants to be a politician. I know he wants to, in 2 years, if DeSantis gets elected, we all know where he wants to go. His heart's not here. One quick thing, mask. An N95 mask, which is a very, very, very thick mask. Used to you had to be fitted for them to prove they actually fit your face and they work correctly. Almost difficult, if not impossible, to breathe through long term. They filter, I believe it's down 0.3 microns. The COVID-19 virus is 0.1 microns. So even the thickest mask, which I never see a kid wearing an N95 because they couldn't stand it. I mean, adults can't stand them for long. So here he is overstepping his bounds once again, thinking he's a doctor, thinking he's an epidemiologist. So more videos to come. I just wanted to share this one. Keep this in mind right here. Thank you.